Metformin might not be the best idea. If you want a better way, it depends on you. For example, Mariah had been diagnosed with type 2 diabetes, and her hemoglobin A1C was 8.2. That meant her blood sugar was averaging around 190, and her doctor prescribed metformin. And she did a little research, saw the side effects, and thought, I don't want to just take a pill and have the labs look better. I want to reverse the problem. I want to do this the natural way. This slide shows what's happening inside Mariah's cells. We're using a muscle cell here to show you that the blood sugar had elevated over the years enough to be considered diabetes. Inside the cell is where the muscle was turning glucose into energy. And in order for that glucose to get inside, insulin needed to lift it across that cell membrane. Before the diagnosis of diabetes comes the diagnosis of insulin resistance, which means the blood sugars have risen over the years, and so has the insulin, in hopes to take that blood sugar from circulation and put it inside the cell. When insulin binds to its receptor, it sends a message for this transporter to move to that cell membrane and pull glucose from circulation into the cell. The more insulin resistant you become, the higher the message needs to be from insulin. That's insulin resistant. Mariah needed a large amount of insulin to get that blood sugar to stay in the normal range. And in fact, with a blood sugar of 190, she was failing. Adding metformin makes it more efficient for the blood sugar to go from the circulation into the cell, lowering that blood sugar. But there's more happening inside that cell when metformin is your tool. So let's move on to what those side effects are that Mariah might be looking at. When you first start on metformin, there is quite a rumble in the tummy. It does have a sense of nausea, which might reduce her appetite a little bit, but is a real concern when you first start this medication. It doesn't take long for that nausea to disappear, especially when patients taper on to the drug. Where metformin has become a concern to me is the space of longevity, where patients will ask for metformin even though their blood sugars are normal. This craze for metformin came about that when a type 2 diabetic would start on metformin, they had an increased longevity, an increased survival. And unfortunately, this got translated that if you didn't have diabetes, that metformin might improve your survival as well. In late 2022, this study looked at just that. They were looking at humans, they were looking at the previous 8 years, and they had a case-controlled cohort study that allowed us to say, if you had diabetes and we put you on metformin, even if only for a month or two in the past 8 years, how did that survival rate compare to folks that were similar age, education, and other social factors when they'd never taken metformin and were not diabetic? And what they found was a higher death rate for any of the patients who had taken metformin. So the first thing my brain said was, of course they died faster. They had diabetes. Having high blood sugar continued to be a very dangerous part of aging. That high blood sugar in circulation is linked to a stroke, heart attack, eye problems, from the gums to the kidneys to every place where that blood circulation is delivering nutrients. High blood sugar gums up the problem and decreases the delivery of oxygen along with other nutrients. This study did not answer all the questions. In fact, there is a pending study called TAME that we are anxiously awaiting to see, do people that don't have diabetes, when they take metformin, live longer? And those results are not out yet. So let me tell you the real side effect that I worry about is causing some of these lackluster results in longevity when it comes to metformin. When we add metformin to a diabetic or non-diabetic, we know that their resting lactate doubles and sometimes triples. Lactate is a fuel, and it is the first churn of the citric acid cycle, or the TCA cycle, otherwise called Krebs cycle. This powerhouse happening inside your mitochondria is how well can you take fuel and turn it into energy. And when the oxygen demands are low, or when your mitochondria is weak, you will settle for lactate. So what's this have to do with metformin? Metformin blocks complex 1 inside that mitochondria. So the fuel of glucose can come in, turn into lactate, and then it's blunted. The power inside that mitochondria is muted. This is a good thing to pull glucose into the muscle cell, but it is not a good thing if you're trying to get the most energy out of that glucose. So in summary, metformin blunts the power of your mitochondria. And that's not something I want to do to my mitochondria, but it is a better trade-off than high blood sugar. So should Mariah take her metformin? Well, certainly if that's what her doctor is prescribing, she should work with her doctor to figure that out. But if she's trying to reverse this diabetes, there are important lessons that should be learned. And the answer isn't take berberine, because that's exactly the same mechanism of a drug. The right answer is to lower those carbohydrates enough to reverse her diabetes. The answer is increase the power of her mitochondria through routine exercise. In fact, if she wants to reverse diabetes, the question I keep asking is it possible? Dr. Jason Fung and I have a great conversation trying to answer just that.